Steve Mair, over 15 years of healthcare leadership, operations, experience in fast-paced hospital systems. Previously to Fresenius, I ran the busiest ER in New York State for several years until kind of pivoting to, again, another really fast-paced clinical environment with Fresenius and working with chronic kidney disease. So right now, I think, healthcare is still organized by location, but, cardiovascular disease is continuous. The solution isn't more guidelines, but you need more shared workflows. So every cardiovascular patient should leave the hospital setting with, some type of scheduled follow-up appointment with that office, medication reconciliation done with them, and some type of automatic notification I've seen really help. I think, like you said, I think healthcare has plenty of data. It's just sometimes we use it too late. Most of the dashboards are retrospective, so to speak, there, but by the time we review them, the patient has already been readmitted. I think the data only matters when it triggers some type of action. The go-to always is kind of more physicians, but I think it's better team design. I think the chronic cardiovascular care works best when, there's a care coordinator, some type of nurse navigator in the process, and just standardize again patient education, I think is huge. If the patient does not know everything that's going on within their care post-discharge, that's kind of when everything kind of falls apart. The highest value investment is proactive management. I've always kind of been a big proponent of that. So again, some type of follow-up infrastructure with that patient, monitoring and just overall access to care is going to be huge for that patient.